Good afternoon, ladies and gentlemen. Salam sejahtera and salam satu Malaysia. Hi guys, good afternoon. Hi. Okay, welcome to watch Doctors Go Live by Columbia Asia, and of course this round is by Columbia Asia Hospital Klang. Alright, it's our honor here to be with all of you to share with you guys. Today we are going to talk about when heart disease patients get COVID-19. What will happen? How are you going to overcome all the consequences? What are the precaution steps that you should take? Today we have our doctor here, Dr. Handsome. He will appear shortly, but before that, if you are watching this live, ladies and gentlemen, sila tekan like and of course share out this live first, okay? Siapa-siapa yang tengah menonton this live ni, okay? Yes, this is our a very great afternoon today with the Columbia Asia. Jadi kita akan cakap pasal kalau heart disease patient ni kalau dapat COVID-19 apa akan terjadi, korang kena macam mana nak jaga badan semua tu. Tapi sebelum ni kami nak ingatkan korang semua ingat untuk like this post dan share out this live post ni kepada kawan-kawan korang, sebab nanti after the whole sharing by doctor, we do accept questions as well. After the whole sharing, we will have a quiz session. Excited gila kan? Tak sabar-sabar nak bagikan the gifts to all of you. Hari ini kita dah sediakan foldable travel bag for Columbia Asia Hospital Klang. Nanti kalau korang nak dapatkan hadiah ni, mesti sekarang juga share this live post ni. Dan then the whole thing, okay, dah berakhir ni, kita akan adakan satu quiz. Dan kalau korang tak ada share kan, tak boleh join quiz ni. So please share it out right now. And of course, yes, we have all the comment side down here. Kalau korang ada apa-apa soalan ke, hari ini sangat-sangat happy sebab doktor akan berada dekat sini. Kalau korang ada soalan, letakkan dekat comment side saja. Just type in your questions down here. Doctor will, maybe he will pick your question and then he will answer you directly. Biasa tu kalau kita nak pergi hospital, nak jumpa dengan doktor tu, takut juga kan nak keluar dari rumah, lepas tu kena beratur juga kan. No, today we will answer your questions directly from Doctors Go Live. Okay, and I rasa korang mesti tak sabar-sabar kan nak jumpa Dr. Handsome hari ini. Today we have Dr. Shahrul. Dr. Shahrul dah ready? Ladies and gentlemen, let us welcome Dr. Shahrul. Hi.
Assalamualaikum warahmatullahi and a very good afternoon. Thank you very much Kay for giving me the opportunity, memberi kesempatan pada saya untuk memberikan sedikit sharing lah tentang berkenaan dengan apa akan berlaku, especially with heart disease patients when they get COVID. Sudah tentu kita memang seboleh-bolehnya tak mahu untuk dapat COVID ni lah. In fact myself, yourself too, dan siapa yang mendengar pun kita tak mahu COVID. But dalam keadaan sekarang kita tak boleh tahu adakah kita ni sendiri akan dijangkiti COVID atau tidak. So without wasting time, I think I can't wait to present apa yang akan saya sampaikan. Dan mula sekali saya nak bagi tahu, if you don't mind, I'll talk in Malay and I will talk in English. So campur dua-dua lah sebab kita orang Malaysia, so kita cakap dua-dua sekali lah ya. Okay.
Yes.
Back to you, okay?
Doktor, kita sangat honor tau sebab kita ada doktor, consultant internal medicine physician and interventional cardiologist at Columbia Asia Hospital Klang. Title panjang, mesti responsibility tu lagi hebat kan? Dan ada banyak peminat juga hari ini. Tengok Azima cakap hi Dr. Shahrul, Ahmad cakap hi doktor. Ada lagi Farmi. Siapa lagi? Oh, banyak komen ni. Zuhaimi, hi doktor. Doktor nak cakap hi lagi? Kita nak start dah. Okay. Kalau korang ada apa-apa soalan, nak bertegur apa ke, nak hi ke, okay, boleh leave your comment dekat sini. Mala say hi doctor, I'm Mala, MO from CAH Keras. Wow.
Ini celebrity. I think I should get Mala to talk on my behalf so that I can hear.
Okay, next round. So celebrity today is Dr. Shahrul Zuraidi Idris. Okay, doctor, are you ready?
Yes, thank you.
Alright, let's begin the sharing.
Alright, okay. So, ada keluar tak?
Dah, okay.
You boleh nampak ke?
Slide is here. Yes.
Yes, okay. So, when heart disease patients get COVID-19. Okay, I'll present first. I can present dan kemudian later on we'll have question and answers. If you have any question regarding my slides, please by all means cuba tanya lah ya. Okay. Mula-mula
Okay.
sekali saya nak start dengan this quite a famous quote. Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less. Okay. Pagi tadi, semalam, in fact beberapa hari lepas, 2-3 minggu lepas, kita banyak dengar, unfortunately lah, our fellow Malaysians, ramai yang unfortunately they take their life, you know, they either suicide, bunuh diri dan sebagainya. A lot of it got to do, I think, majority got to do with COVID. Sama ada takut dengan COVID ataupun hidup stres dengan COVID dan sebagainya. So I think kita sebagai rakyat Malaysia, orang yang prihatin, of course kita feel sorry for some people lah. But for ourselves as well, kita kena faham. Dan nak faham tu kita kena belajar, dan one of these session yang kita akan go through, kita akan tengok supaya bila kita faham kita tak takut, dan kita faham lebih dan kita akan semakin kurang takut dan kita akan live with this COVID. Kalau kita ingat kes yang pertama di Malaysia, about 3 warga negara Malaysia yang terkena COVID, 3 of them, that was on the 25th of January 2020. So that was about 1 year plus ago. So masa tu kita very fearful of COVID. In fact, kita sangat risau dan kita tengok apa yang berlaku di Wuhan, China, dan slowly, dan kita mentality kita tengok Malaysia, alah sikit 20 orang, 50 orang sehari, 100 orang, slowly naik 1000, 2000, akhirnya 10,000, 15,000 dan in fact sampai ke 23,000. Dan kita tengok pula death rate tiap-tiap hari. Dulu kalau kita tengok the death ada nak senarai sakit apa dan sebagainya kan. Dan sekarang ni dah tak boleh nak disenaraikan because it's about 300 plus on a daily basis. So of course these things will make us fearful. Kita akan takut. Tetapi bila kita faham tentang COVID, kita ni dan kita akan hidup dengan COVID. YB Khairi Jamaluddin, our newest Ministry of Health Minister kan, ada sebut tentang kita akan move from this epidemic term towards endemic term, meaning that kita akan hidup dengan COVID. I ada sebut sebelum ni, kalau mula-mula masa kita ada MCO, kita ingat lagi tak masa kita first MCO? I think that was in March kan, if I'm not mistaken. March, April kalau tak silap. I think that was last year sometime. Masa kita MCO 2 minggu yang pertama kan, then we thought by 2 weeks, by I think June was it in June?
Yes.
Kan, our first MCO lah, MCO 1.0. Masa tu kami doktor, we like myself, we don't feel it so much lah because kita akan ke hospital, jadi kita memang kerja seperti biasa lah. Tetapi of course majority population akan rasa risau duduk di rumah dan sebagainya ya. Kita jaga kita, sila duduk di rumah dan sebagainya. We are the frontliners. Dia are the terms yang kita guna dululah. Masa tu kita ingat COVID ni hanya hidup di Malaysia selama lebih kurang maybe the most 2 months, maybe 6 months. By end of the year things will be finished kan. Tetapi unfortunately up till now, as we speak now, we are on the September, 8th of September, we are still living with COVID, and we know that this is not going to go away at any time soon. It may be with us 2 years, maybe 4 years, maybe 5, we don't even know. And we will have to live with it. So we cannot understand, kita kena faham, dan so sampai kita dah tak rasa risau, tetapi bila kita tak risau tu, kerana kita ada langkah-langkah penjagaan yang kita kena buat lah. So I'll go through to my next slide. Okay. This is the actual, magnified form of COVID. I'm sure we all have seen this before, and we talk about the spikes kan, the mutations, the spikes, macam mana dia boleh masuk ke badan manusia dan sebagainya. So there are few names, SARS-CoV-2, 29, and nCoV, HCoV-19, and the term was given is COVID-19 because it was discovered in 2019 in Wuhan, China. So if you still remember during that time, yeah. Okay, sedikit on the statistic cause of death. Kenapa kita interested with cardiology lah? Because one, I kerja sebagai cardiologist, kedua pun I kerja as a physician, so I look both. So kalau kita tengok the 5 principal cause of death in 2019, the first one is actually ischemic heart disease. So as a person with cardiology background, we have to know that majority of our people in Malaysia have got ischemic heart disease, and is the main commonest cause of death. Yang kedua adalah pneumonia. So kita akan belajar lebih lanjut tentang kesan-kesan COVID, macam mana dia efek pada heart kita, pada jantung kita dan sebagainya lah. So this is the statistic yang saja nak tunjuk. Okay. Kita it's just a run through very fast quickly on COVID.
Okay.
Revision, yes. 80% of cases worldwide, including Malaysia, will have a very mild symptoms. The majority would have fever, cough, breathlessness, susah nafas. Kemudian 43% would have fever sahaja without any susah nafas dan sebagainya. Coughing about 50%, sesak nafas saja 29%. Myalgia 36%. Myalgia is actually sakit-sakit badan lah, sakit-sakit rasa sendi-sendi dan sebagainya, berat dan sebagainya. Okay. Runny nose 6%, hidung selsema lah Sore throat about 20%. So 1/5 daripada 5 orang ada seorang akan rasa sakit tekak. Headache about 34%, 34%. Jangan terkejut sebab nausea, vomiting, hanya rasa nak muntah, rasa nak ni pun about 12% sahaja presentation dia. Abdominal pain dan diarrhea. So kalau nak tengok nausea, abdominal pain, diarrhea is lebih kepada sistem perut kita, pencernaan kita. Dan interestingly, especially we are talking about this Delta virus, dia akan lebih affect more of the GI symptoms lah, yang hanya present without having any sesak nafas dan sebagainya. Yang quite interesting juga, yang discovered is actually some people have got loss of smell or taste, anosmia, dan majority once you dah baik daripada COVID, you will recover completely lah from this anosmia. So I think this is the quick run through lah of the main symptoms that people do get with COVID.
Doktor, tapi possible juga kan kalau dia dapat COVID, dia ada heart disease tapi dia tak ada symptoms langsung kan?
Betul. Kalau we'll go through the stages, tapi memang kalau kita kata tentang COVID, kan I'm sure kita pernah dengar tentang COVID stage 1 to COVID stage 5. Stage 1 itu tidak ada simptom langsung lah. Tetapi bila you datang check, contohnya you nak pergi operation ataupun you nak pergi start kerja, you nak pergi overseas, tiba-tiba check, ada positive swab. I don't have any symptom, tidak ada sakit dada, tidak ada susah nafas, tidak ada demam, feel like normal sahaja. Tetapi bila check, positive. So that would be under stage 1. So termasuklah ada sakit jantung atau tidak ada sakit jantung lah. Okay. Interesting to see, this is a data daripada UK lah. Kita akan tengok UK, US dan ada juga data daripada Malaysia. About 91%, this is a slightly older statistic that was published last year. 91% of those who died of COVID in England and Wales in March 2020 had at least one underlying condition. Heart disease, among the most common condition, is 14%. So statistik dia about 14% orang yang ada sakit jantung akan meninggal oleh kerana COVID lah. What about US? In US was published dalam one of the journal publication, the American Journal of Medical Science in October 6, 2020. Mortality tu maksudnya kadar kematian lah for people with COVID yang ada sakit jantung between 10.5 to 14%. Saya nak share, in Malaysia it's about, ada yang dipublish sometime last year, it's about 23.4%, even more. So almost quarter, 1/4 pesakit yang meninggal di Malaysia oleh kerana COVID mempunyai sakit jantung. So we are talking about quite a big number of population ataupun pesakit. Yes, ini adalah satu statistik yang ada di Malaysia. Again, this is a slightly older statistic, end of last year October, ni yang saya nak sebutkan tadi. Even as we talk now, if I'm not mistaken, we have about 1.8 million, correct me if I'm wrong, cases of COVID yesterday, 1.8 plus and it's about 1%, it's about 18,000 deaths. Again, correct me if I'm wrong, but it's roughly about 0.99% lah, about 1% rate. So of 100% infected with COVID, 1% akan meninggal dunia. And unfortunately for me, it affects more of a male than female. So at least about 2/3 is male lah. Kemudian kita akan tengok age group. Majority membabitkan orang yang berumur 60 ke 69. Although again, this is the statistic last year, I have to say. kalau statistik yang baru ni belum dikeluarkan lagi, tetapi saya difahamkan bahawa COVID ni banyak membabitkan orang yang kurang berumur 40 tahun dan ke bawah lah, ataupun 40 tak sampai 60 tahun lah, ya. So probably this
Teenagers
statistic
pun banyak kan?
correct, ya. Especially with this new variant lah yang berlaku akhir-akhir ini. Kemudian you see underlying health condition, because they look at the people yang telah meninggal dunia, majority would have diabetes. Kedua adalah darah tinggi, about 64%, 54.9%. And then heart disease lah, about 23.4% yang saya sebut tadi lah. So about 1/4 have got heart disease. High cholesterol, 19% kidney disease. Okay, cuma saya nak ingatkan, kadang-kadang kita selalu tertipu. Kalau kita ingat dululah masa first COVID came to Malaysia, during the mid-2020, kita banyak risaukan tentang orang yang mempunyai comorbid. Maksudnya orang ada sakit jantung, kencing manis, darah tinggi. But you heard the stories nowadays, you don't have to have any reason, unfortunately, to pass away. Yeah. So because of this new variant, orang yang tak ada sakit apa-apa, umur dalam 20-an, 30-an, presented with stage 4, stage 5 dan mereka meninggal dunia. So that's very, very unfortunate. But again, having said that, still the old statistic menunjukkan orang yang ada sakit, contohnya sakit jantung, lebih risikonya lebih tinggi lah. Ya.
Okay.
Okay, any questions so far? Ya. Okay.
Tak ada.
Right. Sorry.
Doktor cakap sangat, like very detailed. So I rasa, okay.
I'm so sorry, this slides is very busy, quite busy, but I just want to show again the same thing. This is again statistic showing what I've said earlier lah, but this is another, not Malaysia lah, different countries. Again, hypertension, diabetes, yeah, coronary heart disease. But Malaysia, interesting, is about 23% lah. Kalau you tengok yang tengah-tengah tu, coexisting disorder, or we call it comorbidities, yeah. And then the age, we want to look at the brown color, yeah. The brown color is the severe, itu yang teruk lah, stage 4, stage 5, yeah. So affecting more of the elderly lah. But interestingly, kalau you tengok the first part tu, 15 to 49 years of age, brown color 41%, 41.1%. So please don't say I'm young, I don't have any problem, I'm not worried about getting coronavirus because I'm healthy, yeah. Please, this is one of the take-home message from this talk that I have today. Okay, back to our discussion today. I'm a heart patient and I'm being diagnosed of COVID-19. What should I do? Apakah yang saya, okay. First thing, of course, bila kita ada sakit jantung, kemudian tiba-tiba kita diberitahu kita ada COVID, sama ada kita ada simptom atau tidak ada simptom, what should I do? Apa yang perlu saya lakukan? Okay, sekarang things have changed quite a bit. Because of the influx of so many patients going to CAC, I'm sure we have seen the viral videos di Shah Alam kan, Stadium Shah Alam contohnya, mereka yang duduk di Lembah Klang ataupun di Klang di Bukit Tinggi kan, yang beratur terlalu ramai. So eventually I think government have decided for us to just report regularly and just update about our condition from day 1 to day 10 about our condition lah, yang having COVID with MySejahtera. In fact, if I'm not mistaken, wearing the glang is not mandatory. Correct me if I'm wrong lah. So kita cuma perlu update in MySejahtera. Okay, so anyone who have got heart condition, of course, first and foremost, once we got the report to know that we have COVID, we have to do that, and we have to understand the COVID stages 1 to 5, and we'll go through that. And then what are the home isolation do's and don'ts? What are we supposed to do and what are we not supposed to do? And when do we actually need to seek help? Okay. Yang pertama, I think I did mention earlier, even yang ada sakit jantung atau tidak ada sakit jantung, stage 1 adalah stage yang tidak menunjukkan sebarang gejala. You tidak tahu punya ada sakit COVID. You just came for swab, suddenly became positive. Ataupun friends you ada COVID, you check, unfortunately you pun ada positif tapi tidak ada simptom. So ini dikatakan tahap yang ringan lah. Yang ini yang dikatakan boleh melakukan home quarantine, duduk di rumah walaupun ada sakit jantung, ya. Yang kedua adalah bergejala ringan. Okay, tiada radang paru-paru, maksudnya tidak ada, in English term kita call it pneumonia lah. Macam mana kita nak tahu kita ada radang paru-paru atau tidak? Biasanya kita akan ada simptom, maksudnya sesak nafas dan sebagainya. Kemudian kalau doktor buat X-ray, imbasan X-ray akan melihat perubahan di X-ray menunjukkan dia ada radang paru-paru, ataupun daripada mendengar auscultation ataupun daripada mendengar paru-paru lah, kita boleh tahu sama ada tu seseorang tu ada radang paru-paru atau tidak. So itu stage kedua. Stage ketiga, itu yang tiada radang paru-paru ya, Stage kedua ni maksudnya dia ada semualah dia tak ada susah nafas, tapi dia ada demam, mungkin dia ada muntah, dia ada sakit badannya, tapi tidak ada susah nafas, tidak ada radang paru-paru. Okey, yang ketiga, dia mempunyai gejala, ada demam, ada sakit tekak, ya, ada hingus dan sebagainya, tetapi dia juga mengalami radang paru-paru, dia macam rasa sesak sikit, rasa sesak nafas sikit, ya. Yang keempat adalah mereka yang mengalami radang paru-paru, yang merasa sesak nafas dan mereka memerlukan bantuan oksigen. Mereka perlukan oksigen sama ada melalui hidung ataupun yang dipakai face mask lah, melalui mulut dan sebagainya. Okay. Yang kelima adalah yang teruklah bergejala kritikal, memerlukan rawatan intensif di unit rawatan rapi ICU dan mempunyai organ-organ lain yang bermasalah lah, kegagalan organ yang lain terutamanya buah pinggang, jantung dan sebagainya. So I hope I'm clear with this stage 1 to stage 5. Please stop me if or you can ask later if you have any question regarding the stage 5. So very important to know that stage 1 to stage 5. So for especially for heart patient, we have to be very careful, especially if we are at stage 3 to stage 5, yeah. Okay. Right.
Doktor, tadi doktor cakap pasal heart patient kan? Tapi boleh tak kalau doktor cakap sikit untuk pengetahuan saya sebenarnya juga, sebab like a bit nak tahu kan, what are the heart diseases that are very common in Malaysia? Okay. Kalau mereka terkena.
Okay. Kalau orang you mean yang berkaitan dengan Covid-19 ke? Ataupun okay.
Terutamanya yang berkaitan dengan Covid-19.
Okay, berkaitan dengan Covid-19. Okay, orang yang mempunyai masalah pada jantung, yang paling common, yang paling selalu dilihat adalah masalah yang dipanggil myocarditis. Myocarditis ini maksudnya in English term maksudnya myo means muscle, ya. Myo means muscle. Carditis ni maksudnya jantung. So jantung, kalau katalah ini jantung, I don't know whether you can see this. Jantung ni dia punya muscle dia tu, dia mempunyai masalah dipanggil inflammation, ataupun dia boleh kata dia macam membengkak dan mungkin dia gagal berfungsi, dia punya muscle. So myocarditis is the main common cause. How do we establish, macam mana kita nak lihat tentang masalah myocarditis ni? Melalui imbasan ekokardiogram, kita buat scan jantung, kadang-kadang kita akan buat MRI cardiac, kadang-kadang kita akan buat ECG, dan juga blood test. Dia akan menunjukkan masalah-masalah myocarditis dan juga contoh-contoh darah seperti CRP dan sebagainya. Yang kedua, masalah yang boleh berlaku pada pesakit jantung adalah masalah kelemahan jantung. So apabila berlakunya myocarditis ataupun pericarditis, myocarditis ni saya sebut tadi adalah masalah radang kepada muscle jantung tu. Pericarditis adalah selaput di luar. Okey, kalau kita tengok jantung kita mempunyai dua selaput di luar ni, ya. So selaput ini dia boleh juga bermasalah. Dia boleh jadi keras, dia boleh jadi berair di dalamnya. So these are the problem yang boleh berlaku dan dipanggil pericarditis. So myo dan pericarditis ni adalah dua benda yang paling banyak berlaku pada orang yang ada masalah jantung, ataupun orang yang tak ada masalah jantung tetapi dia terkena ni, dia jadi sakit jantung. Ketiga adalah masalah thromboembolism, maksudnya berlakunya ketulan darah, sama ada di dalam salur darah ataupun berlaku juga di dalam jantung itu sendiri, adanya berlakunya darah beku. So bila berlakunya ketulan darah, dia boleh menyebabkan seseorang itu boleh terkena serangan jantung, walaupun tidak se-common, tidak sebanyak seperti myocarditis, tetapi peluang untuk terkena serangan jantung apabila terkena COVID itu lebih tinggi, ya. Keempat adalah masalah arrhythmia ataupun rentak jantung. Dia menjadi terlalu laju. Pengalaman saya, ada dua sakit saya yang stage 4, di akhir-akhir selepas kita memberi rawatan dan sebagainya, mereka terkena masalah rentak jantung yang laju 150 ke 200. jantung dia, kelajuan jantung tersebut. Menyebabkan kita terpaksa shock memberikan you pernah tengok kot dalam TV kan, yang kita bagi kita bagi shock, electric shock ya, untuk
Saya tengok Meredith Grey.
Yes,
The Grey's Anatomy maka Asya buat tu cardiac arrest, cardiac tetap panggil.
Betul. So these are the things yang boleh berlaku lah kepada orang-orang yang sakit jantung. So ini adalah benda-benda common lah, tetapi yang paling selalu berlaku adalah myocarditis, maksudnya radang kepada muscle jantung tersebut. So did I answer your question?
Yes. So terutamanya kalau mereka dah sakit jantung, kalau dapat lagi COVID-19 tu lagi kena berhati-hati kan?
Betul. Kita juga pernah ada seorang pesakit yang terkena serangan jantung, dalam masa sama dia kena COVID. Saya kena ceritalah, kami dalam lingkungan pakar-pakar jantung yang ada di Malaysia, at least lah yang kita selalu dengar, sebab kita tengok kajian. Kalau kita ingat ya, di Malaysia sebelum kita adalah yang teruknya adalah Spain, betul tak? Spain, Italy dan juga in fact UK pun sama. So apa yang kami dapat daripada pakar-pakar jantung di sana adalah kadar serangan jantung mereka agak tinggi. So bila mereka datang dengan heart attack, unfortunately difahamkan mereka juga terkena COVID. Satu lagi yang saya suka nak sebut adalah I will talk in my later punya slide, tetapi ada orang yang memakan ubat yang tidak sepatutnya mereka makan, menyebabkan jantung tu jadi tak sekata dan berbahaya. So itu juga boleh menyebabkan satu masalah lah. So orang yang kena COVID kemudian dia makan ubat yang tak apa-apa ubat, menyebabkan jantung dia tak sekata dan boleh menyebabkan kematian, unfortunately. Okay, I go to my next slide.
Boleh.
Tadi saya ada sebut tentang, kalaulah kata kita ada sakit jantung, kita dah tahu apa yang kita perlu buat, My Sejahtera, kita perlu tengok stage 1 sampai stage 5. So alarm akan datang apabila kita ada stage 3, stage 4, stage 5. So kita kena pastikan kita sentiasa at stage 1, stage 2. Kalau dah ada stage 3, we may have to be very, very, very careful dan make sure that someone is around or we are always in contact with someone. Because a lot of the cases BID, kalau kita perasan, mungkin kita tak pernah dengar tentang BID sebelum ni, tetapi BID brought in that adalah majoritinya oleh kerana respiratory disease ataupun tak boleh nak nafas, ataupun kedua terkena serangan jantung lah di rumah dan bawa di sini dah tak boleh buat apalah. What do we need to do? Apa yang 10 benda yang kita buat semasa COVID-19 ni? This is the slide, very good slide that I got American punya, from the American punya CDC, correct. Stay home. If you have possible or confirmed COVID-19, stay home except this applies to anyone with COVID regardless ada sakit jantung atau tidak lah. Stay home except to get medical care. Duduk di rumah, melainkan kita perlu jumpa doktor ataupun doktor perlu datang ke rumah kita dan sebagainya. Kedua, monitor your symptoms carefully. Kena selalu monitor. If your symptoms get worse, do not wait. Please do not wait. Pengalaman saya melihat orang yang sakit COVID ni, even few hours, even one day will make a very big difference. Jangan main-main. Kadang-kadang pagi x-ray malam dia dah tak boleh buat apa. So please do not wait. Number 3, get rest and stay hydrated. Kena minum air banyak, kena banyak berehat sebab badan ini sebab COVID-19 ini adalah satu sejenis virus yang kebanyakannya badan kita sendiri akan melawan. So bila badan kita melawan, dia perlukan kerehatan yang cukup. So kita kena selalu minum air dan get rest. Keempat, if you have medical appointment or call the healthcare provider ahead of time and tell them you have or may have COVID. So kalau ada appointment dan sebagainya, kalau perlu juga jumpa doktor, kita kena inform lah yang kita ada COVID dan sebagainya. Ada juga kes di mana orang yang ada COVID tetapi mereka berjalan merata-rata. Pergi ke shopping complex, ada yang pergi makan, minum, isi minyak kereta. Saya tak jumpa orang, saya isi minyak kereta saja, contoh lah So ini satu benda yang juga tak baik lah, sebab we have to protect ourselves but we also have to protect others. Nombor 5, medical emergencies, call 911. Malaysia kita 999 lah untuk call ambulance, sebab do not wait for ambulance. Unfortunately, sometimes in especially in a very bad area, last time in Lembah Klang, kalau call 999 pun tak dapat juga, we really have to get someone to bring us to hospital. Do not wait, because nak tunggu 999, unfortunately because of the workload yang terlalu banyak, tunggu sampai 12 jam pun ambulance tak datang. So we have to make our own way. Okay, number 6, cover your cough and sneezes. Bila batuk dan sebagainya kena tutup lah dan kena buang semua tu, jangan dibiar merata-rata. Ketujuh, wash your hands often, selalu basuh tangan dengan sabun dan sebagainya dengan air at least 20 second. Clean your hands with an alcohol base. Selalu pakai sanitizer that contain at least 60% alcohol. Nombor 8, as much as possible stay in a specific room. Duduk di satu bilik saja and away from other people in your home. Please, please, please. In fact, my patient pun ada yang duduk di bilik tetapi bila dia makan kat luar. Dia campur dengan orang lain. Dia kata, saya duduk bilik tapi bila saya makan, saya guna toilet, saya akan campur dengan orang lain. So there's no point in staying in the room because you are affecting others. Okay. Kalau perlu, mesti guna separate bathroom. Kalau tak boleh juga, then you must make sure need to be around other people or inside of the house, wear a mask. You kena keluar dengan mask lah di rumah. Avoid sharing personal
Spray
items.
kan?
Ya, betul, kena spray. Kalau di hospital kita panggil bom, kita kena bom tempat tu. We have to call, this is Covid-19, so we have to clear it. Sanitize betul-betul sebelum kita guna tempat tu, ya. Number 9, avoid sharing personal item. Of course, yang pinggan mangkuk dan sebagainya janganlah kita basuh, lepas tu kita guna bagi orang lain pakai. Kita kalau boleh selama quarantine tu kita pakai yang itu saja, jangan pakai orang lain punya. Okay, number 10, clean all surfaces that are touch often like counter, table dan sebagainya. So kena guna tu lah. There's a lot of disinfectant kan yang you boleh spray saja. So you just use that one. Okay. So this is a very practical things that one should be doing at home lah. Okay, then the next thing is actually our pulse oximeter lah. So saya rasa kita semua dah tahu kot tentang this pulse oximeter. Pernah tengok ya? Have you seen it? Yes. Pernah kan?
Doktor nak show
itulah saya punya dalam tujuh tengok. Nanti kalau ada tunjuk. But anyway, this pulse oximeter in a box. Yes. Okay, this is an example of yes, this is an example of pulse oximeter lah, ya. So kita masukkan jari kita dan kita tunggu, ni mungkin tak ada bateri lah. Anyway, get a battery and then kita nak tengok berapa the reading of our heart rate and our pulse, ya, our heart rate and also oxygen. Tapi yang kita paling takut adalah oksigen lah, especially oksigen kalau dia bawah daripada 95%. In fact, pengalaman saya bila dia dah start turun daripada 90%, kemungkinan besar you are already at stage 4. Meaning that you cannot play around, tak boleh tunggu sehari lagi, 2 hari lagi, nak makan ubat ni, nak minum vitamin ni, nak ni tunggu dulu, nak tidur dulu. Besok kalau okey baru, tak okey baru saya pergi hospital. Please don't do that. Because if you sayang diri you kena buat secepat mungkin. Jangan tunggu lama-lama. So of course 92% atau kurang, definitely 999, or even if you can make it yourself, go to hospital or get someone to drive you to hospital. Okay. So please, the take home message. Okay, tip and tricks for heart patients.
Yes. Alright.
Okay. Right, number 1, take your heart medications. Okay, banyak orang kata saya sakit COVID, saya tak boleh ambil ubat, nanti ni, itu, ini, nanti sebab saya kena COVID, saya takkan sakit lain, saya sakit COVID saja. So saya kena jaga diri saya tak perlu makan ubat darah tinggi, tak perlu. So please, you must always take your heart medication no matter what. Unless there are reasons or that your doctor believe that you have spoken to doctor said to stop the medicine lah. Yeah. Number 2, avoid unproven medications to treat COVID. Again, there are so many unproven medications. Dulu-dulu kita ada guna ubat untuk malaria. Contohnya hydroxychloroquine. I think our their ex prime minister president US kan, what's his name Donald Trump was very into this hydroxychloroquine, but eventually it was retract back lah. So we shouldn't, because there are side effects that we need to look for. Plus it has problem with the heart also, hydroxychloroquine. Then there is also azithromycin antibiotic. Then there are just vitamins without having to go to hospital, for example. And the latest, I think we all know about this ivermectin. Okay, so please listen or get the advice from the proper people lah. Yeah. Okay, number 3, get vaccinated as soon as possible, no matter what. Okay, I have so many patients with cardiology problem. They will ask me, am I safe to get vaccination? Can I be allowed to take vaccination? Can I delay? We have seen the statistic tadi kan, di UK 14%, di US 14 to 19%, di Malaysia 23.4%. People with heart disease, they passed away because of because of COVID lah. So we know that there are so many proven scientific evidences to show that vaccination does a lot. The simplest thing we can see, I'm from Selangor, we see in Selangor itself, the rates have come down dramatically. Yesterday sahaja dalam 2000 plus, being satu masa dulu dalam berbelas ribu kan, in Malaysia the rate. So what can we say about it? Have people just wake up or what? No, it's because one of it, we have to say, because of the success vaccination program that we have. People are not scared anymore. Last time people say vaccination, let the politicians saja pergi, then get the doctors saja pergi vaccination. No, that's not the way, because sakit jantung, apa-apa yang sakit lagi cepat nak kena vaksin. We have my own patient, I have my own patient 80 plus, dia ada sakit jantung, ada macam-macam sakit lah, in fact asthma, yang pergi kena vaksin, then they do well. Of course, there are so many theories and stories that you can put sudu, you put sudu, you can get the sudu tak jatuh. You can be tracked down where you are. There's so many conspiracy theories. But I think as a professional, we go with evidence based. Kita akan tengok kepada apa yang ada proven, black and white. Okay. Number 4, I think we always hear this, especially from our KP Kementerian Kesihatan, Dato' Isham, always say about double mask. Initially kita pakai single mask, but now the studies proven to show double mask. Sorry, I'm not wearing mask now because I'm alone in my room. And then we wear face shields again with this the Delta virus kan, it's airborne. We have to wear face shield and practice our 3W and avoid 3Cs lah: crowded, confined, close, wash, wear and worn. Okay, so this we have to take very careful lah. Okay, maintain healthy diet. Unfortunately, with this, during this COVID pandemic, so many people are during MCOs, they just don't do nothing at home, they just watch TV and sit unhealthy diets lah. So please, yang ada sakit jantung especially, betul, so you really have to look after yourself too. Even though kalau patient selalu kata, I tak boleh keluar rumah, I takut COVID, but you can do something. You can do even your cardio exercise in your home, in front of the TV, for example. Okay, you lari-lari setempat, your house couldn't be that small lah. You at least sekurang-kurang boleh lah lari depan TV tu kan.
Ada lagi exercise untuk berdiri saja kan pun boleh buat kan?
Tabata dan sebagainya kan. A lot of other exercise. Okay, so maintain healthy diet, maintain exercise 100. As a cardiologist, we always say about 150 minutes cardio exercise weekly. Depends lah, you nak buat 2 kali seminggu ke, 3 kali seminggu ke, 5 kali seminggu ke, but in total at least about 150 minutes. And then if possible about 10,000 steps daily. Ini pun boleh buat kat rumah. UMCO pun you boleh step sahaja, tak perlu nak keluar rumah. Okay. Number 7, get updates on COVID from authentic sources. As I said earlier, there's so many spam messages, there's so many things, bad things that people are spreading around. But at the end of the day, you look at us, we want the best for our patient, we want the best for our own country. Of course, we want to try the best for everyone. So please get updates on COVID from authentic sources. So I think in short, as a cardiac patient, makan ubat seperti biasa, you jaga diri, you mesti jaga supaya you tak kena COVID. Okay, that's the first thing. You have to, jangan keluar kalau tak perlu. Okay, you avoid everything that can bring you to closer contact of COVID. Tapi kalau dah kena, there are the steps that we need to do. And even if you quarantine at home, you can still survive. It's not to say that once you have COVID, I'm a heart patient, I will not make it, I tak akan berjaya hidup. No, that's not the way. Okay, because we have read there's patient yang umur 90 lebih, 100 lebih, they survive COVID. Cuma you have to get a proper treatment and know when to get help properly when it's time, especially when you're entering stage 3, 4 and 5. Okay. So I think that's about everything that I want to talk on the matter. So back to you.
Okay, so sekarang kita pun open up this session kepada siapa-siapa nak tanya soalan dengan Dr. Shahrul, cardiologist dekat sini. Korang boleh terus type out kat bawah sini. Okay. Meanwhile, kita akan pick lah the questions untuk doktor kan. Meanwhile pun nak tanya kan, doktor, sebab tadi doktor dah ada satu list kalau patient, sebab hari ni kita cakap kalau heart disease patient when they meet COVID-19, apa akan terjadi, then the precaution step kan. Sebenarnya I rasa doktor sangat detail cause steps tu kan bukan sekadar yang ada COVID-19. Kalau tak ada COVID-19 tu actually taking medicine, just like what Mala mentioned, continue taking your heart medicine sebenarnya memang satu nasihat untuk semua heart disease patient kan. Kena ke tak mesti kena take that medicine, dan kena ke tak lagi bagus tu kalau ada healthy diet kan doktor.
True.
Lepas
Just,
tu yes.
satu saya lupa nak sebut, masa 2020 last year ada satu people worry about one type of medicine dipanggil ACE inhibitor, ada satu ubat lah untuk darah tinggi. People say it's not good because it will interact with COVID punya ni, but again it's just a theory, it's not proven. Okay, in short, semua ubat yang ada untuk jantung sepatutnya boleh dimakan even when you have COVID, unless you are in the hospital and there are reasons for doctors to withhold your medicine. Okay.
So basically everything just go back to your doctor and then listen to his advice kan? Sebab doktor paling like know your condition. Then doktor satu lagi kan, while waiting for more questions to come in, kita collect, nanti kita tanya. Sebab tadi doktor ada cakap dekat kena get vaccination secepat mungkin. So boleh tak kita dengan dekat sini kita clear the rumor sebenarnya kalau korang ada heart disease ke, kalau kena vaccination akan the side effect lagi banyak, semua ni tak true kan doktor?
Tak ada. I've never said sebab I banyak patient saya sendirilah yang jumpa saya, memang mereka akan kata saya pro pada vaksin because myself yang treat patient yang ada COVID, we look after COVID patients. Era before the vaccine and after the vaccine is totally different. Orang yang dah kena vaksin, okay, bila even one shot or two shot, bila kita treat dia akan respon agak cepat. Dan in fact kalau ikut mentality yang sebelum ni, before ada COVID vaccine langsung, patient ni sudah tentu tak ni lah, with the blood test, dia punya CRP tinggi more than 150, X-ray ni. Tetapi bila dia ada vaksin, kita dapat melihat bahawa dia punya antibody yang dihasilkan oleh vaksin tu sendiri, dia membantu badan untuk melawan benda tu. So you imagine it's like your soldiers that you already implanted in your body. So memang kita sendiri, based on our real experience, saya boleh, in fact saya bertanya dengan kawan-kawan yang kerja, because ourselves kita taklah terlalu banyak sakit COVID, but again we still have some experience. Kita bincang dengan kawan-kawan yang kerja di Hospital Sedang, di HKL, in fact di Sungai Buloh sendiri, memang mereka lihat mereka yang telah ada vaksin, walaupun mereka kena COVID, dia punya, walaupun dia kena stage 3 lah katakan, ataupun stage 2, stage 1 or even stage 4, tahap untuk dia sembuh itu majoritinya akan berlaku agak cepat dan senang untuk kita bagi ubat dan sebagainya. Reacted very fast lah. Berbanding dengan mereka yang vaksin naif, yang tidak ada vaksin, memang kita kena start from scratch dan memang agak susah untuk kita ni lah. So because of this lah, saya melihatkan bahawa mereka yang ada sakit jantung ni with this range of 23% mortality risk untuk meninggal oleh kerana COVID kalau ada sakit jantung, lebih baik kita cegah dia dengan vaksin ataupun kita kurangkan kesakitan tu, the degree of the illness itself. Dulu orang kata COVID ni bila kena vaksin takkan kena COVID, tidak ya. Kita selalu sebut bahawa mereka yang kena vaksin boleh kena COVID juga, especially bila population ni masih ramai yang tak kena vaksin lagi kan. We need to achieve the herd immunity at least up to 80%. Tapi Malaysia masih tak sampai lagi lah. But bila kena pun kita boleh kata mereka kalau kena pun stage 4, mereka senang untuk kita look after. Thank God lah because of the vaccine itself.
Okay. Just like doctor mentioned earlier for the first slide, it is actually to live together with COVID kan?
Yes, true. It's endemic.
Okay.
It's endemic, correct.
Okay. So, sekarang kita ada banyak soalan dekat sini. So, doktor boleh nampak soalan semua tu tak? Banyak.
Yes. Okay.
Doktor nak pilih satu
Sure.
soalan untuk jawab dulu tak?
Boleh.
Tak sabar-sabar mereka nak dapat jawapan.
Okay, ada satu soalan. Doktor, saya ada soalan. Boleh ke pesakit menyimpan tong gas oksigen di rumah? Adakah digalakkan? Ada nasihat untuk penyimpanan atau penggunaan terbaik? Thank you, doktor. Okay, kita kena ingat bahawa, thank you very much Mr. Hadbibis yang bertanyakan soalan.
Dia memang sangat suka Had lah. Nama pun Had Baby kan?
Hadbibis lah, saya nak kena beli dia punya domain ni, dia punya Facebook. Okay, anyway. Kalau kita tengok balik yang basic tadi, ya, stage 1 to stage 5. Okay, stage apa yang perlukan oksigen? I nak check you balik. You ingat tak I cakap tadi? Stage apa?
Stage 4 ke?
Nasib baik betul. Kalau tak, I dah tutup dah ni. Okay, stage 4 is when it's not time to stay at home. To be honest. Okay, I faham. Sebelum Malaysia teruk dulu, kita tengok di India contohnya. Mereka buy oksigen ni. Okay, kita kena ingat bahawa COVID ni treatment dia bukan hanya oksigen semata-mata. Okay, there are so many other treatments that we will give in patient yang masuk kerana COVID. Antaranya injection di perut, dipanggil Klaksin untuk mengelakkan daripada darah beku. Ada ubat antiviral yang kita bagi. Used to be kita bagi Favipiravir. Ada ubat yang lawan modulatory immune system tu yang kita bagi, contohnya Remdesivir. Ada kita bagi baricitinib, ada kita bagi tocilizumab. So banyak ubat-ubat yang kita akan bagi kalau dia dah sampai stage 4, terutamanya steroid, methylprednisolone, dexamethasone. So benda-benda ni tak ada di rumah. Jadi kalau you hanya bagi oksigen, okay, macam orang yang, macam nak cakap ya, kalau orang yang sakit tetapi you hanya bagi ubat yang sikit saja, tapi yang lain-lain untuk stopkan ni you tak stop, dia tak akan habis macam tu. Sebab oksigen tidak akan mematikan kesan-kesan teruk yang ada dalam badan oleh kerana COVID. So you imagine benda tu akan menyebabkan you duduk di rumah lama dan tidak pergi ke hospital dan tak mendapat ubat yang sepatutnya. Sebab itulah antara sebab-sebab yang boleh menyebabkan seorang tu BID, brought in dead, adalah kerana mereka hanya bergantung pada oksigen di rumah saja. So I'm really against, saya tak setuju tentang menyimpan tong gas oksigen. Bila nak simpan gas oksigen pun, you tahulah oksigen di rumah ni dia boleh bagi 5 liters probably the most, ataupun mungkin 10 liters, dan dia akan habis. Kalau orang yang masuk hospital ni, mereka akan perlukan oksigen yang berterusan. So apa yang akan buat bila oksigen dah habis di rumah tu? Dia bukannya regenerate again. You kena gunakan yang lain. Dan banyak ubat yang you tak boleh bagilah. So you miss the opportunity untuk treatment. Ingat saya sebut tadi, kalau dah sampai stage 3 atau stage 4, you kena cepat pergi hospital untuk kita bagi rawatan yang secepat mungkin. Bukan sahaja oksigen semata-mata. So I hope I answer your question. So I really don't recommend. I think we still have enough. In fact now you boleh saja pergi ke hospital. Kalau tak boleh tunggu ambulans, you pergi saja hospital. You just land up yourself in either emergency in a private hospital or even in government hospital. Okay?
Okay. So I'll pick one more question. Okay, then lepas tu doktor pick lagi. Okay?
Okay.
Alright, so I'll pick, this is from Guan. I think this is a very good question for those like they wanted to know more about this COVID-19 one. A heart patient who recovered from COVID-19, is there anything he or she should take note on? Anything we need to have at home to stand by? Sebab I rasa sekarang kita mungkin kebanyakan masa tu kita pun dekat rumah ke? What are the precaution steps?
Okay. Well, a heart patient who recovered from COVID-19. Okay. Patient yang dah recover from COVID-19, in short kita akan panggil COVID survivor atau mereka yang telah survive COVID ni lah. Ya? I'm sure kita pun pernah dengar ada orang yang terkena COVID, duduk di hospital 10 hari, 14 hari, kadang-kadang 21 hari, kadang-kadang ada sebulan. Ya? Bila dah balik rumah, still rasa tak, not recovered fully.
Tak completely sehat.
Betul. Dan dipanggil long COVID. Ataupun long COVID ni banyak simptom-simptom. Antara yang paling, whether it's heart or not heart patient lah, Yang paling utama yang kita buat, I think they did a study in Sungai Buloh, yang paling kesan yang paling mereka komplain adalah rasa letih, penat cepat. Penat. Okay. Nombor 2 adalah susah nafas. Rasa tarik nafas tak cukup. Tetapi doktor kata you dah okey dah COVID tu, ya. Nombor 3 adalah susah tidur. These are the commonest things lah. Okay. What about heart patient? Okay, of course heart patient, I think the first thing is that you need to monitor yourself more closely. Kalau you ada cardiologist ataupun pakar jantung yang sentiasa jumpa you, yes, we are more than happy to see you even after your quarantine. Of course, during the COVID, we also need to look after ourselves. So we may not, we probably get until you finish your quarantine and then you come and see us. Of course, there are things that we do. First thing, we might want to consider to do echo scan jantung tu. Kita nak tengok ada tak kesan COVID jangka panjang pada jantung. Macam saya sebut tadi, myocarditis, pericarditis. Because this in future, dia akan menyebabkan kita lemah jantung. Okay, then maybe later we may want to consider whether there's any heart blockage or what. That can be resulted from the COVID itself. So of course, cuma dekat rumah you kena standby. I think even with satu ubat yang you pernah makan, kena diteruskan makan. Kedua, I think you have to still continue taking your blood pressure. Okay, the 3 things that you need to have at home. Actually 3 things lah. Blood pressure, your thermometer, and then your oxygen saturation. Okay, these are the 3 things at least for the heart patient must have at home. Okay, blood pressure because you need to know. Because sometimes I have seen patient yang ada COVID, lepas dia kena COVID, dia punya blood pressure goes high. Very high. 180, 190. Before kena COVID, dia tak ada masalah itu. So you may
macam
need
satu lagi effect from COVID.
Yes, unfortunately. Okay. Kemudian yang kedua, dia kena selalu check oxygen level lah, sebab even though you dah sihat daripada COVID you dah tak ada, tetapi there will be some long term effect. We call it such as pulmonary fibrosis. Maksud paru-paru tu sudah jadi sticky, dia sudah jadi keras. These are the things that we do like a CT scan. Sometimes our patient masa masuk kita buat CT scan of the lung. After balik, maybe after 6 weeks, after 1 month, we will do another scan just to compare. But majority, thank God, majority of our patient will recover properly. But it takes time. Sometimes take as long as 3 months, sometimes even 6 months. So the main thing is that if you are worried, please go and see some doctors, either your cardiologist or even your own GP or your own, to make sure that you are still on par. These are my advice lah to have. Okay.
Okay. Doktor, tadi doktor first tu tadi doktor ada mention Mala kan? So let's pick her question, okay? Adakah pesakit jantung perlu dapatkan penilaian pro-vaksinasi sebelum mengambil vaksin atau boleh ambil je?
Okay. Thank you very much, Dr. Mala, for highlighting the issue about pre-vaccine assessment. Yes. Well, depends on what sort of heart patients you are. Kalau you adalah pesakit yang very stable, yang tak ada issue for so many years dan makan ubat dan you regularly jumpa doktor, I don't think you need a proper assessment before the ni. Maksudnya mungkinlah you makan ubat cair darah, contohnya aspirin, ubat darah tinggi, ubat kolesterol. Maybe you had a heart attack 3-4 years ago, 3-4 tahun lepas, tapi stable, selalu setiap tahun jumpa doktor. Pada saya dasarnya tak ada masalah. In fact, dia tak ada proper guideline on this lah. But we had a recent conference between our cardiologists, and we said people like recent heart attack, for example, okay, people yang baru saja taruh stent, for example, yes, you may need some time. Stent ni maksudnya yang mereka datang ada blockage, kita taruh spring kan, ataupun buat bypass operation. You need some time, at least time frame, maybe 2 weeks, maybe 1 month before you consider to take your vaccine. And again, you need to see your cardiologist before you go for the vaccine. Satu lagi pesakit adalah mereka yang contohnya pesakit jantung yang ada injap, tukar injap. Pernah dengar kan? With the plastic valve or something like that lah, prosthetic valve we call it. Mereka ni kadang-kadang mereka makan ubat cair darah. Contohnya warfarin, okay? Untuk relating the blood. This is not aspirin, bukan Plavix, this is warfarin. So yes, in the guideline it says warfarin, kalau siapa yang ada makan ubat ni warfarin, mereka tahu mereka kena ambil darah, check the INR level every 1 month, 2 months or 3 months or every 6 months ya. So bila mereka check ni, must make sure, I suggest mereka yang ada ubat warfarin, check dulu darah mereka, make sure the INR is not above 4.0, tidak lebih daripada 4. Dan kalau lebih daripada itu, then lebih daripada 4, then you may have to stop that before you go for the vaccine. Okay. So I hope I answer Dr. Ma's question.
Okay, Doctor, before we go with the next session, right, sebab nanti kita mula-mula cakap ada quiz kan, lepas tu kita nak hadiahkan, you know, the gift for the people here, 3 gifts kan. So we just want to have a reminder to all of you, kalau korang, if you are still watching this live, make sure you share out this live post, okay? Reminder to all, okay? Kita bagi korang the time for one more question, lepas tu kita akan pergi quiz, okay? Kita bagi mereka chance sikit, okay, Doctor? Sebab tadi Dr. Syebania pasal how to take care kan semua tu. So mungkin tadi semua orang tengah buat nota kan, sekarang baru you know like analysing. So we will give you the time to share this live post right now. Share this live post, lepas ni kita akan ada quiz, okay? So now we take in one more question. Let's see. Alright, let's pick this one. Okay, this is from BK. I read that COVID-19 can cause heart problems such as heart attack. Ni high tech punya word lah. Is this true?
Yes. Thank you very much, Bikitan, for asking such question. Agree. I think I did mention a little bit on COVID itself. Well, the mechanism macam mana COVID can cause heart attack or arrhythmia is still debatable. But yes, I agree. There are people who end up without having any risk factors. They came to hospital with heart attack and actually they had COVID at the same time. People say that because if you imagine COVID, they have factor ataupun chemical yang menyebabkan darah itu menjadi beku lebih cepat. Okay, it can cause darah beku di dalam paru-paru. At the same time, it can cause darah beku in the heart itself, which can be the cause of the heart attack. Yeah. Okay, arrhythmias is actually simple term means jantung yang tak regular ataupun tak sekata ataupun masalah kepada the heartbeat tu. Yes, again, COVID-19 can cause arrhythmia because it is, do you remember just now I said about myocarditis, the muscle inflammation radang muscle tu. Dia kalau ada muscle tu masalah, dia boleh menyebabkan arrhythmia berlaku. Okay, first. Number 2, kalau kita ambil ubat-ubat yang tak sepatutnya, contohnya ubat chloroquine, okay, contohnya ubat azithromycin, these are the things that can cause prolonged QT dan menyebabkan irregular heart rate yang membahayakan diri seseorang. Nombor 3, that I didn't mention yet just now. If you imagine, there are also people, unfortunately during the COVID season when it is very, very bad, mereka tak pergi ke hospital. Okay, mereka tak pergi ke hospital, mereka sakit pun mereka tahan. Okay, so sometimes
takut nak pergi.
Takut nak pergi, even nak jumpa saya pun takut sebab takut kena COVID. Datang jumpa saya pakai semua sekali. It's okay lah, no problem. Cuma my point is that mereka sebenarnya dah ada this problem of heart attack even before the COVID comes. Tetapi mereka tahan setahun 2 tahun sampai dah terlalu lambat, sampai mereka terkena COVID, dah tak tahan demam dan sebagainya, sampai at the same time it just, because heart attack can happen bila kita ada satu benda yang stres dalam diri kita. Okay, sama ada stres dari fikiran ataupun stres daripada mechanical chemical dalam badan kita, a lot of adrenaline rush, hormon-hormon yang dikeluarkan menyebabkan kita boleh terkena heart attack lah, unfortunately. So yes, COVID-19 definitely can cause heart problem, even people who are quite normal in previous time before the COVID itself.
Okay. So yes, thank you for the answer, Doctor. Sebab kan ada lagi satu satu soalan backstage cakap ni mesti kena tanya juga. Ni soalan penting juga. So before we go with the last question, I give you one more chance guys. Okay, ladies and gentlemen, please share out this live post. Okay, because right after this, jangan pergi mana-mana, share out this live post, like our Facebook page, and right after this, we will have a quiz time. Okay, foldable travel bag might be yours. Okay, doctor. So here comes the last one. So susah doktor, sorry satu lagi question je. Okay, sebab banyak lagi mereka so excited kan. The last one is by Siti Akila Syed. How should patients with heart conditions manage workplace exposure to COVID-19? Actually, this one also hooked me as well. Like, sebab kita sekarang kalau, memang ada heart disease tapi nak pergi kerja sekarang memang tak, terbuka kan. Memang nak pergi kerja. How doktor?
Very difficult. Nanti semua orang cari saya, semua orang kata tak boleh pergi kerja.
They all of them arrange meeting kan dengan doktor.
Yes. Okay. Basically, it's case to case basis lah. Okay. Bila kita, when we group someone with heart condition, it depends on what type of heart condition it is. Okay. Kalaulah seseorang itu heart condition dia, jantung dia terlalu lemah, maksudnya, we assess pesakit jantung ni berdasarkan kepada kekuatan jantung. Normal jantung, kalau kadang-kadang yang pernah jumpa doktor yang buat echo scan, ultrasound kepada jantung, normal jantung tu percentage about 50% ke atas lah. Tapi ada orang jantung ni lemah dalam 15%, 20%. Okay? Memang orang ini sangat-sangat bahaya. In fact, kalau mereka terkena apa-apa sakit, jantung tu nak cope dengan stres tu memang tak boleh. So definitely this kind of patient would have a special sort of precaution yang lebih daripada orang lain. Tetapi I have to also mention orang yang katalah pernah kena serangan jantung, heart attack, maybe 10 years, 5 years, 3 years, 2 years ago, kan? Dia punya chances untuk kena COVID dengan orang yang tak pernah kena sakit jantung dari segi blockage ni, dia tak ada beza. Okay? In other words, yourself, myself, and patient I yang kena heart attack 2-3 years ago, memang tak ada beza pun, sama je. Cuma bezanya adalah kalau terkena COVID, of course it's more difficult to look after because you have heart problems lah, the comorbid yang
underlying
Yes, underlying condition. So that's why I say it's a case to case basis. At the end of the day, I think everyone needs to really manage their workplace exposure well. Macam I sebut tadi juga, orang yang tak ada sakit jantung pun nowadays kalau terkena Delta variant yang muda pun boleh terkena stage 4. So it doesn't make you as a heart patient a bit more special than non-heart patient, but ada certain condition macam I kata tadi, jantung terlalu lemah atau pakai bateri, contohnya pacemaker lemah kan. So you may have to have more precaution lah. Mungkin kena jumpa bos, kena sebut tentang jantung saya begini-begini, I may need some time, especially kalau ada positive cases dekat situ. So sebab tu kalau you tengok KP Kesihatan, our DG always try to get the idea of work from home, kerja dari rumah. In fact, practice in our own hospital as well. At some point when the things are very bad, we try to segregate patient yang kita make in shift lah. Kalau yang boleh kerja di rumah, administration, we do at home, we work at home. We don't expose ourselves. Because kalau kita duduk di rumah, our expose is less. So kalau benda dia boleh buat melalui komputer saja, dan buat melalui komputer. No need to come to hospital. But of course, people like myself, we are the frontliners. We cannot shy away. We have to see patients. So I hope I do answer your question, yeah?
Okay, thank you, doctor. Thank you so much for the sharing. Okay, they did mention, thanks doctor, very insightful sharing. Thank you for the answer, very detailed. All right, okay, thank you so much for the questions, guys. Okay, here comes another session here sebab kita akan adakan quiz sekarang. Doktor, kita adakan quiz sama-sama. Nanti I pun jawab juga, doktor tengok benar ke tak, okay?
Betul.
Okay, quiz ni sangat mudah saja. Nanti we will have 3 questions, alright? So once first okay, quiz time ladies and gentlemen, be ready and make sure you have shared out this post. Kalau belum lagi, sekarang share lagi, masih sempat. Sangat mudah saja sebab kita ada 3 soalan. Sebelum kita review the question, right? 3 questions. So nanti kalau korang nampak the 3 questions, they will be like show sekaligus. So kalau korang dapat the answer kan, terus tengok 1, 2, 3, terus type out the answer. So it is actually a true or false one, okay? It's either true or false. Korang letak your jawapan, terus type in. So we will pick, okay? Lagi cepat, lagi mudah, lagi laki, okay? So korang kalau memang ada pay attention, I think you can really answer this quiz very, very accurately. So korang dah bersedia? Okay, doktor dah bersedia? Doktor tengok saja. Doktor jadi guru hari ini, okay? So alright, let us ask. Senang sangat. So remember, all of the answers please write in the same comment. Okay. So the first one, kalau korang ada jawapan terus type in sekarang, okay? Meanwhile, let us just read through. The first one, heart patients should stop taking their heart medication when they are found to be COVID-19 positive. True or false? The second one, alright, heart patients should not be vaccinated against COVID-19 in case of internal bleeding. True or false? And the third one, when a heart patient contracts COVID-19, alright, heart attack is the most common complication to happen to the patient. Is that true or false? Oh, wah, korang cepat 1, 2, 3. Yes, sayang korang kena letak all the answers 1, 2, 3 sekaligus dalam satu komen. Alright, cepat-cepat tulis-tulis. And yes, our crew we actually pick the lucky one. And now sekarang nak tanya soalan peribadi. Yay, nak tanya soalan sikit. Dr. Shahrul, ada banyak soalan untuk doktor tadi kan. I nak tanya doktor asal dari mana ni? Mungkin ada banyak fans kan, atau mungkin nanti akan terserempak dengan doktor ke tak?
Okay. Thank you very much, Kay, for asking the question. Saya gembira mengaku saya berasal daripada Negeri Sembilan.
High five, doktor. Sama.
I was born in Tampin, Negeri Sembilan, and my mother is from Rembau, my father is from Tampin lah. But I'm happy to say I'm from Rembau or Tampin lah. Our current health minister pun from Rembau kan, but I don't know him lah, yeah.
We know him, doctor. Kita memang know him.
But I'm being brought up more in PJ lah, Kelana Jaya.
Patut. Perwibawa. Okay, nampak smart, doktor.
Thank you very much.
Okay, so the next one kan nak tanya juga sebab doktor hari ini title hebat kan, Consultant Internal Medicine Physician and Interventional Cardiologist. Doktor, sebab last time I tengok drama kan, they will pick their own, mereka nak specialize dekat mana satu bidang kan. Sebab apa doktor nak pilih cardio? Dan apa secret nak jadi pakar cardiologist yang yang canggih, yang hebat dan boleh jawab soalan macam mana nak jadi juga?
Thank you very much, Kay. I think you still boleh kalau nak jadi doktor. Tidak, masih muda, boleh, no problem. Okay, yes, semasa saya belajar, saya bertuah kerana dapat belajar di UK lah, di United Kingdom dan buat few trainings over there. I stayed about 15 tahun di sana lah, dan dapat bekerja di banyak bidang lah, di kardiologi, di bahagian jantung, di bahagian sakit orang tua, endokrinologi, di bahagian surgery dan sebagainya. Tetapi yang paling saya minat ada 2 saja, sama ada untuk jadi pakar jantung ataupun jadi pakar bedah otak, neurosurgery. Tetapi saya fikir-fikir balik, bila saya jadi neurosurgery, dia punya nak diri atas buat operation tu terlalu lama, saya tak tahan. So I chose to become a cardiology. To me, cardiology sangat, kalau ada sesiapa yang nak belajar jantung ataupun nak jadi doktor ataupun anak-anak nak jadi doktor, saya rasa senang saja. Jadi pakar jantung ni, you punya satisfaction, you rasa seronok kalau you dapat selamatkan nyawa pesakit lah. With all credits with other specialties, kerja-kerja lain yang di dalam bidang medicine, tetapi kalau untuk jantung ni, sama ada dapat hidup ataupun tidak. When they come with heart attack, tercungap-cungap, jantung jadi terlalu laju dan sebagainya. So we have to act straight away dan kita tak boleh buat silap. So I like the atmosphere, rushing atmosphere, adrenaline pumping dan sebagainya, because we see the result there and then. Tak perlu tunggu lama. So that is one of the biggest reason lah why I choose to become a cardiologist, a heart specialist lah. Okay.
Kena firm kan? Sebab I rasa tengok doktor firm juga, like macam in whatever condition doktor pun you can actually react like in a very calm. So hebat doktor. Cantik the CV kan. Thank you so much for the sharing. Okay, sebab sebenarnya I nak borak lagi banyak tau, sebab last time I tengok Grey's Anatomy kan, I was like wah, I tengok semua season tau. So I macam like, when you don't know doktor akan ada perasan tak, my mata ada that heart dekat my mata, that emoji, Yeah, guys, thank you. Yes, okay. If you're having the same feeling as in like me, korang pun boleh share, type in comment for doctors. Thank you very much for the sharing. Like the post and then share out this live post to all your friends. Let them know they can actually benefit from the sharing, and might as well they can just put in emoticons for the doctor. In Chinese we say 刷一排爱心, bagi emoticon tu sangat panjang macam tu. Alright, thank you doctor for the sharing. So I think we have the winners in already, doctor. Shall we review the answer first? Okay.
Yes.
So I think for me all the 3 one they are actually false lah. Kalau after dengar sharing from the doctor. So we will look at the answer now. Okay, doctor, ready?
Yes.
Let's review the answer now. Let us announce the answers first. Okay, yes, it's false for number 1, for number 2, and number 3. Heart patients should stop taking their heart medication. No, should not stop. Tadi doktor dah cakap, memang kena take your medication kan, doktor?
True.
Yes, betul sekali. Okay. Then heart patients should not be vaccinated. No. Okay, it's a false one. And the third one also false. When a heart patient contracts COVID-19, heart attack is the most common complication. No. Okay, so yes, the answer's false for all. And now let us announce the winner. Ladies and gentlemen, okay, kalau korang tekan win, jangan risau, we will PM you. So jangan takut kita akan PM you and then get your information. Alright, ladies and gentlemen, we would like to say a big thank you. Sebelum thank you, a big congrats to BK Tan. Yay! Congratulations. The next one is Anna Chong. And lastly, Muhammad Fight Lee. Ada geng doktor tak dekat sini? Tanya kepada semua. You guys can actually get this foldable travel bag. Thank you so much for your participation. Kalau korang can, if you're still in the live, say thank you as well so that we can see whether you are here. Oh, yes. Mereka dah pin the winners dah dekat sini. Oh, yes. Yeah. Okay, Doctor, kita dah ada winners. Congrats to all the winners. Please wait for the PM from us. Now, sebelum kita cakap bye-bye kan, tak nak cakap bye-bye pula. Doctor, ada apa-apa, like any comments ke ataupun any nasihat for them? Your last word for them.
Thank you very much. I'm so happy and I'm very pleased to be given the opportunity to talk here. I do hope, even though I've talk for so long, I hope I do not bombard you, tidak terlalu banyak informasi yang terlalu tinggi untuk kita semua lah. Yang paling penting, saya rasa kita kena melihat bahawa COVID ini adalah satu cabaran yang kita perlu hidup bersama, tetapi ada langkah-langkah yang kita boleh buat. Kalau kita semua takut pada COVID, tak ada siapa nak jadi doktor. Kami semua larilah, ya. So, kita akan hidup dengan COVID. COVID akan menjadi endemik. Siapa yang ada sakit, please do not stay at home. COVID ni pada saya macam sakit jantung juga. It's a very fast ni. Kalau dulu kita tunggu 8, 9, 10, 12 hari, 14 hari. Nowadays, hari kedua, ketiga, keempat kita dah melihat seseorang itu boleh deteriorate very fast. So, it's a real thing. It can be very serious, but I think kalau dalam awal-awal lagi kita dah ambil langkah-langkah, I do hope, as we Muslims say, insyaAllah, we've got grace, we will win against this COVID. And I do pray that one day we can be like UK, for example. We can, you don't have to wear mask anymore, and we can go anywhere we want. Bila kita nak pergi jalan-jalan, kita pun tak tahu at the moment lah. Yeah. So we have to
Yes.
kita jaga kita kena look after ourselves, but at the same time we have to protect others as well. Just a very very last reminder. Kadang-kadang kita fikir kenapalah saya nak contohlah ambil vaksinasi. Buat apa? Sebab badan saya sendiri yang rasa, saya sendiri yang takut, saya sendiri yang akan menjadi. Kita kena ingat bahawa bila kita tak ada vaksinasi dalam badan kita ada potensi untuk menyebabkan orang lain terkena kena COVID dan sebagainya. So sebab tu kita kata kita jaga kita, tapi kita kena protect others as well. Kita kena jaga orang lain. So saya harap apa yang saya sampaikan menjadi sedikit panduan berguna kepada kita semua. Thank you so much Kay for being a very good host. I ingat nak teruskan lagi 1 jam, tapi itulah nanti orang lain marah pula, ada kerja lain.
I pun tengok soalan banyak kan, I pun rasa wah tak sabar-sabar nak jawab ke semua kan, tapi tak apa, kalau korang lagi like interested nak tahu lagi banyak dengan doktor, you can always check out our Facebook for more updates, for more information. And kalau korang tengok lagi, kalau korang nak tengok next time I nak tengok this sharing from Dr. Shahrul, I nak tengok ni sharing lagi berkaitan dengan topik apa, korang pun boleh let us know down here kan. Sebab hari ini just like
just last just to maybe you all can just share my email lah. This is my email, Shahrul Zuraidi Idris @columbiaasia.com. So if you have any sort of question, boleh nampak kan? Okay, if you have any questions, or I'm more than happy to help. At the end of the day, it's not to say that I'm better than anyone else, but I'm just here to share at least some of my experience and some of my knowledge, that I do hope that we want everyone to be well. No matter you kena COVID ke tak kena COVID, we want everyone to survive and lead healthy life at the end of the day. So soalan-soalan tu hopefully I will answer. Kalau you all boleh tinggalkan email tu nanti, then you just email me lah whatever question that you have. I will try and my best to answer them. Thank you very much ya.
Oh Allah, doktor terharu. Ada lagi email, boleh terus tanya doktor soalan. Bukan setiap kali boleh dapat email lah doktor. Thank you. Korang dah dapat kan dah email kan? Catat kan? Okay, ada apa-apa soalan email doktor. Sebab I nampak banyak soalan mungkin tak sempat nak jawab. And of course, semasa tanya doktor kena cakap thank you tau. Okay, kena email dengan soalan yang cantik-cantik. Okay. Dan pada masa yang sama, kalau korang stay tuned to our Facebook, sebab mungkin next time kita ada lagi banyak sharing topik yang sangat menarik. Dan kalau korang berminat pun boleh share this live post with your friends, let them know, let them to get benefits from the sharing together. Just like what doctor mentioned, kita jaga kita, we will win this war, right?
Yes, we will.
Yes, okay, alright. Thank you Dr. Shahrul for the sharing. Thank you Columbia Asia as well for the Doctors Go Live program. So yes, we will meet you guys in future time, not long after this, okay? So stay tuned, we will meet you guys again. Take care and stay home, okay? Stay home, stay safe. Thank you doctor. Bye.